Hello there, everyone. Are you someone like me who struggles to fall asleep at night, stay asleep, and needs to get more naps in during the day? Then Manta have the products for you. Manta sent me a couple of their sleep masks that I've been using the past couple of weeks, and I have seen my sleep improve drastically. I'm currently using their Manta Warm Mask, which is perfect for those who have some sinus issues or dry eyes, and especially because it's getting in the cooler temperatures, I get dry eyes. All I do is I pop these very cozy iPads in the microwave for a little bit, put it on my eyes, and feel the instant relief. These masks are cozy, adjustable, comfortable, and block out almost all the light, so you can get amazing sleep. So what are you waiting for? Link is in the description. Sleep better, anywhere, anytime with Manta. Thank you, Manta, and have a great night. Okay, looks like we have a cranial nerve examination very soon. Okay, anytime. Hello there. Are you here for an exam? Perfect timing. Were you sent in by the nurse? Okay, perfect. Please do come on in and get cozy. This can be quite a long exam, okay? So, just sit at the exam chair. That's just a meter in front of me, okay? And just face my direction. Perfect. Good. Okay. I'm just signing you in here that you're on time. Okay. So, welcome to the exam room here in Dream City Clinic. I am the neurologist here. I am Dr. Luna. Pleasure to meet you. Yes. And it appears here you need a bit of a cranial nerve examination and a concussion assessment. Is that correct? Yeah. So, okay. On my paperwork, questions for you, okay? And I'm going to let you know everything that we have. All of our conversations will be confidential, just to better assess your health. Just be as honest and concise as possible, okay? Good. Could I just double check your name? What's your name? Is that spelled with an I or an E? Okay. And last name, family name. Okay. And with your birthday. Good. And what's your home address? Okay. So it looks like that's the same as before. Perfect. Okay. And prior to this, were you examined by a nurse to assess your health? Good. Okay. Perfect. So, thank you for that. Just a couple of preliminary questions. Now, just a couple of personal questions. How are you feeling? Physically first, how are you feeling? Okay, I do see that you do have a bump right on your forehead on the left side, right? Does it hurt? Does it feel like there's a heartbeat in it? Okay, I'm just going to get a bit up close. I'm not going to touch. I'm just going to take a look, okay? Could you close your eyes for a second? Perfect. Just close your eyes for a second. Okay, open your eyes again. Does that look a bit... does look a bit interesting, doesn't that? Yeah. And how are you doing mentally? It's okay to be not okay. A bit worried? Okay. And how have you been the past 2 weeks, both physically and mentally? Okay. Okay. Thank you for that, by the way. So, have you ever had a concussion before, or a cranial nerve exam? Okay, so what we're going to do, I'm just going to explain it very carefully, is I'm going to examine your cranial nerves, and I'm just going to take a look at the bump on your forehead. This is a neurological assessment to make sure that, especially after an injury next to the head, next to the brain, that everything is working properly, okay? Good. I promise it's calming, and if you feel uncomfortable at any moment, let me know, okay? Good. So, I'm just going to get some gloves on first. And can you recollect how you bumped your head? And again, be as honest as you can. I have fallen in mysterious ways. Okay. So, you were tired. You dropped something on the ground and got back up too quick and hit yourself under a desk. Honestly, not as bad as I expected of a story. One time I was so tired I rolled off the bed and I hit my head right on the nightstand next to it. I had to explain that one to my doctor. So, here we go. Okay. What we're going to do first is just a quick assessment of your eyes. Okay. I'm going to just quickly put my hands over your eyes. Is that okay? Thank you. So, just gonna hold and put a bit of pressure. Please close your eyes, okay? I'm gonna count down from 10. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Okay? I'm gonna get a bit close, please. I do apologize for getting so close, okay? Just taking a look here. Can you look at my finger? Good. Follow it as closely as possible with both your eyes. Good. And then I'm just going to get a bit more close. Keep looking at my finger. And look below. And look above. And look below. Okay. Good. Now look at me. Look at my nose. Look at me. Look at me. Look at my nose. Good. 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 I'm going to use a pen light now. And if you did have a concussion, this can sometimes hurt. I'm going to just shine the light into your eyes like so, okay? Okay. So, just look at me. Look at my nose. Look at me. Okay. Very good. And okay. Is that difficult for you? No. Very good. I'm going to just take a look. And release. You okay? Good. And taking a look. And perfect. Gonna test this eye now. Okay. Okay. Very good. Good. Let's do it again. Perfect. Good. Let's do it again. Perfect. Very good. Okay. Now I'm just going to close your eyes very carefully. Good. Okay. And release. Perfect. Have you noticed that you've had any changes with your vision since you've hit your head? Such as difficulty or inability to read up close or read far away? Okay. I'm going to ask you to do something now. We're just going to test just how quick your eyes can work. I want you to first look at me and do not look at the lights surrounding you, okay? Avoid the distractions. Keep looking at me. at me. Good, look at me. Good, look at me. Good. Look at me. Very good. Now I'm going to ask you just to carefully, with your eyes, follow the light. Going to be looking for signs of concussion while we do so. Okay. So just follow the light. Let's begin. Okay. Let's see. There we go. Okay. Good. Don't move your head or your neck when you look. Okay. 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 Again, don't move your head or your neck when you look. Gonna hold it. Okay. 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 So, I'm seeing that you're drifting your neck ever so slightly when you're looking, which can from time to time be a sign of a concussion. Not to worry, we're going to examine more. Okay? Good. So, I'm going to put the light away. Next, I'm just going to quickly write down what I saw, which was just your neck moving with your eyes. Eyes. Okay. I'm going to just mark that down. Good. Next, we're going to check your orbitals. Gonna put a bit more pressure on your eyes. Just want you to relax while I do so, okay? We'll count down from 10 again. Go, just a bit of pressure on your eyes. Close your eyes. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And release. Are you having any problems opening your eyes after that? I did put a bit of pressure on them. No, that's very good. Okay. Just taking a look at your eyes now. I'm going to use a tool now. Looks a bit peculiar. But I'm going to look into the back of your eyes, okay? And these are very deep magnifying glasses. They're going to look straight through your eyes. So, just going to put these on, and I'm going to turn the lights on. Okay. I'm just going to get a bit up close here, okay? Take a look. I want you just to relax. I'm going to take a look at the back of your eyes. If you can, look at the lights, okay? Just look at the lights, okay? Carefully looking. 1, 2, 3, 4, 5. Okay. 5, 4, 3, 2, 1. Okay. And over there. 5, 4, 3, 2, 1. Okay. And 1, 2, 3, 4, 5. Okay. Can you look at my nose? Just look at my nose. Thank you. Just gonna be taking a look with this light in particular to both of the eyes. Okay. Okay, keep looking at the light, or look at my nose. Look at the light, or look at my nose. Okay, I do see so. So we are saying that the eyes are wavering just a little bit, which does appear to be a result from trauma to the head. Okay, this possibly could be what I think it could be, but that's okay. Okay. Thank you. So, what I saw there's just a bit of wavering with your eyes when we put a little bit of pressure up close, which typically is a sign of concussion. Okay, I'm just going to write that down. Okay, and I'm going to get a bit up close again. How are you feeling? Just taking a look at your eyes and your eye movement. That's what I'm doing up close. Okay. Going to move on now. I'm going to put a little bit of drops in your eyes, which might help. Especially because the clinic air is very drying. Do notice that your eyes are very dry and overreacting, overworking. So I'm just going to add a couple drops in, okay? You can look down for me. Good. 1 and 2. Good. And again. Look down for me. Good. 1 and 2. Very good. Now if you could mimic me, okay? Just mimic what I do. I'm going to blink together, okay? I want you to close your eyes and open them. Close your eyes and open them. Good. Close your eyes and open them. Good. And close your eyes. Hold for 5, 4, 3, 2, 1, and open them. Good. Do your eyes feel a bit more relieved? Perfect. Good. Do you see the irritations going away? Good. So what we're going to do next is something known as a taste test and a smell test. We're going to test your olfactory sensory nerves, okay? So, I have a bunch of non-labeled essential oils that are right in front of me. And there are no correct answers. However, with the best of your ability, I'd like you to guess the smell of each essential oil, okay? Good. So, some are very common, others are not. Let's begin with this one. Okay. What I'm going to do is I'm just going to put the essential oil under your nose and you guess. Let's begin. So, I love this one. Okay. Now I'm just going to put this next to your nose. Do you recognize that? Okay. What does that smell like to you? Like tea. Very good. I do agree. And one in particular. Perfect. This one is peppermint. Very good. The smells reminds me of exactly like peppermint tea. Okay. On to the next one. This one's a bit more difficult. Okay. Ooh. Here we go. Now, just going to let you smell that one. Any idea what this could be? Okay. Earthy. Perfect. Reminds you of... Okay, good. And any name to this? Any description? Okay. Bit confusing. It's okay. You did get the earthy notes. And you did say it tastes like or smells like. Like what? Let's try that again. Floral. Perfect. Any guess what this could be? Okay. This one's chamomile. And it reminds me exactly of if you've ever made herbal tea from scratch. It's good. Again, there are no incorrect answers. let's continue with this one. Okay. Now, this one might be a bit easy, a bit difficult. Citrusy. Very good. And floral. Okay. Any idea what this could be? Okay, you got this one a bit quicker. This one is orange, but it also smells like lime. Very good. Just a couple more of the smells and then we'll do the taste test, okay? Okay, let's begin and continue. Okay. Any guesses? This one is very strong of a smell. Okay, it smells like a spa. Very good. And what notes are you getting from this? It smells like candy. Perfect. Okay. And any guess as to what this could be? Okay. This one is lemongrass. It smells exactly like a spa. But we test this one because it has a bit of different notes than the other ones. We're going to finish off with one more. That is quite common, okay? You're doing great. So, okay, yes indeed, this one's great. Here we go, it's a little bit strong, so I'm going to pull it just a bit farther away from you. Any guesses to what that is? Floral and lavender. Marvelous. Everyone gets this one. This one's great. Good job. Okay, I'm just going to write that down. Looks like that's working good. Okay. Now I'm just going to ask you a baseline question before we continue with the taste test. Are you feeling any sort of imbalance from that? Do you feel like you're feeling a bit sick or uncomfortable? Okay, you're doing good. Perfect. Thank you. We're going to move on with the taste test. Okay, so I have a little stick here, and we're going to taste test 2 of 3 different essential types of oils, but there are 3 different flavors. It's either going to be salty, it's going to be sweet, or it's going to be a bit bitter. Okay? And you won't know what is what until you taste it. Okay? So, we either have salty, sweet, or a bit bitter. Here we go. And we're going to do this one at random. Okay? I'm going to take a little drop at the top of this. Okay? And I'm going to place this on your tongue, okay? 3, 2, 1. And have a taste. Yes, I do see that you are smiling. This one is very, very sweet. Very good. Do you taste the flavor though? It's bubblegum. Yes, very good. Thank you. Now let's move on to the second. Since you know sweet is eliminated, we either have salty or bitter. Okay. And let's put a little bit of this one on there. Okay. And I'm just going to let you taste that. And I see that you're, yes, sour, a bit bitter. Good. This one is lime. It's direct lime extract. So it makes your face, yes, precisely, very good. So we don't really like to define find it a sour because that can trick you. Very good. Okay, now you're doing well. Perfect. What we're going to do now is we're going to move on to a sensory test. Okay? I'm going to ask you to mimic me, and we're going to test your muscles. Okay? So, if I may put my hands just on your face and your shoulders, is that okay with you? Good. First, going to ask you, I'm going to put my hands right here on your forehead. Okay? Can you lift your eyebrows? Good. Lift your eyebrows. Lift your eyebrows. Lift your eyebrows. Perfect. Now, can you furrow your brow as if you were angry? Just furrow your brow. Okay. Good. And release. Relax. Good. Now, do you know how to lift one eyebrow up at a time? This one would be my right. This one would be my left. Unfortunately, I can't lift this eyebrow, as I actually have an injury right here, which has stopped some of the muscles in my forehead. Are you able to lift both eyebrows, or one at a time? Try your best. Perfect. Good. Okay. Do you see you're experiencing a bit of limited mobility on your eyebrows on this particular side that has the bump? That's okay. Now I'm going to ask you to open your eyes really wide, as if you saw something exciting. So just open your eyes really wide. Look at me. Look at me. Look at my nose. Look at me. Open your eyes really wide. Good. And relax. Good. Now I'm going to just ask you to resist. I want you to close your eyes as tight as you possibly can. I'm going to try to open your eyes. Don't let me do it, okay? Let's begin. Close your eyes. Perfect. Resist. Resist, 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 resist. Very good. Open your eyes. Okay. Great. Now I'm going to ask you to smile without your teeth. As big as you can. Okay. As big as you can. Looking for symmetry here. Okay. Looking for symmetry. Okay. I do see that. Perfect. Now, if you could smile with your teeth, just very goofy smile with your teeth. Good. Looking for symmetry. Good. Yeah, perfect. You can relax. And now frown. Just as much of a frown that you can give, okay? And look symmetric. Perfect. You can relax your face now. Okay? I'm just going to quickly check your ears, put my hands behind them, okay? Just do that. Can you hear that? Does it feel uncomfortable? Okay. I'm going to quickly check your hearing, okay? And can you tell me if it comes from your left or your right side? Good. Let's begin. Okay. 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 Tricky. That's both. Good. 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 Perfect. Let's continue with the muscle exam now. I'm going to ask you if you're able to raise your shoulders as if you are shocked. Just raise your shoulders. Okay, and I'm going to ask you to resist. I'm going to push down on your shoulders, but I want you to keep them as raised as you can, okay? Good. And 3, 2, 1, resist, 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 resist. Good. Marvelous. You can relax them now. Okay. Now I'm going to ask you to do something a bit more peculiar. This is called the palm exam. I'm going to move my palm a little bit closer in different distances from you, but I want you to touch your nose and touch the palm. I'll do it with you, but I'm going to put my hand in different places, close and far away. I want you to touch your nose to my palm with your finger each time. Okay? Relax. So, I'm going to do it with you. Touch your nose. And the palm, good. Nose, palm, good. Palm, good. 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 Okay. It's a distance test. Now I'm going to check your peripheral vision really quickly, okay? So, just really quickly, your peripheral vision. When you see my hand get into your peripheral vision, I want you to raise your hand or say, I see it. Okay? Let's begin. Good. 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 Perfect. Great. Good. Good. Perfect. You're doing great. Now the opposite. When you see my hand leave your peripheral vision, tell me when. I want to raise a hand. Here we go. Good. 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 Great. Good. Very good. You're doing great. I'm gonna write that down. Okay. Looks good. Okay. Now we're going to continue with the exam. Okay. What we're going to do is carefully assess vibrational patterns and reflexes. Okay. I'm first going to test this on your ears. I want you to let me know if you can hear it. And second of all, I want you to let me know if there's a difference in sound from left and right here. Okay. So first I'm going to apply this right here to your left side. Can you hear that? Were you able to hear that? Okay, I'll do it again. Okay. And could you hear that? Okay, now let's do the opposite side. Could you hear that? One more time. And could you hear that? Good. Now was there a difference between the sound of either side? Okay. No. Perfect. Okay. Now I'm going to quickly just test the vibrational patterns with your reflexes. I'm going to hit it on your funny bone. I want to see how you react, okay? So let's first test the right side, okay? And you reacted good. Let's test the other. And you reacted perfect. Now I'm going to just grab your hand. I'm going to put it right at your wrist, okay? Let's test it. Could you feel that? Perfect. And the other hand. On the left side. Could you feel it? Perfect. Good. You're doing amazing. Trust me, you're doing good. Okay. So, what I'm going to do now is something known as a neck movement. I'm going to manually move your neck just a little bit to the left and a little bit to the right. You let me know if it makes you uncomfortable, okay? Just a little bit of movement, not too much. So, here's a little bit of movement. How does that feel for you? Okay, I'm going to let you hold this position for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Are you feeling stable? Okay. Good. Let's bring you back to the center. Good. And let's move it a little bit to the opposite side. Okay. And turning. There we go. Gonna hold you there. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And turning you back to the center. Okay. Did that feel uncomfortable for you, or make you lose balance? A little bit. Loss of equilibrium. We call that vertigo. So, sometimes when you're standing up straight, without moving your neck, you can feel not dizzy at all, but sometimes if you tilt to the side, you can feel a bit dizzy. Do you feel a bit dizzy? A little tired? Okay. So what we're going to do is I'm going to send you into the clinic again. There's a bed for you with a nurse. And what's going to happen is we're going to watch you overnight. We might let you sleep a little bit, but we're going to watch to see that it's not a concussion. Because sometimes falling asleep on a concussion is no good. Okay? I think it might be one, as your eyes are wavering based off of your peripheral vision test and a couple of tests that shown that you are just a little bit sore from the bump on your head. We'll let you know by morning. Thank you so much for coming on by for the clinic. Again, I'm Dr. Luna. I'll also be watching you overnight to make sure that everything is going well. And if you end up feeling bad or whatever the reason may be, I will be right there to help, and so will a couple of nurses, okay? Perfect. Have a good night. I will check up on you soon and show you results in the morning. Good. Thank you for coming on by. So, gonna send them in for an exam in the morning and bed rest.